Here we have now.
Wait. Okay.
Now the male reproductive system is actually, the gross anatomy is kind of simple if you know the tubing. All it is a whole mess of fancy tubing. Okay? So here we go. So you have the bladder, right? And you have this tube, which is called the urethra, right? Now, the urethra has actually three parts to it, okay? The part that goes through the prostate, which is here, right? The part that goes through the pelvic floor, which is here, and the part that runs in the penis. So you have three parts. You have the prostatic, membranous, and penile urethra. Now, since the penile urethra goes through the erectile tissue, which is called the corpus spongiosum, which is this stuff on either side of the urethra, it's called the spongy urethra. Either one is good, okay? So remember, prostatic, membranous, or spongy urethra.
Could you turn it and then say it again, please? And say it again.
Oh boy!
And the bladder.
Prostatic, membranous, and penile or spongy urethra, okay? Three parts. Now, so that's the urinary tract and reproductive tract. That's common. Okay, so then you have, take the throat band off so you can see. Okay, so then you take this piece out. Okay, now what you have here is this is going to be the rectum, right? Here's the rectum. Here's the prostate, here's the bladder. And that's why to palpate for like a prostatic tumor or something, you have to put your finger in the rectum and feel, right? Okay, because it's right there, see? Okay, so now we have these structures, the reproductive system. Okay, so now you have the testis, right? It's covered by the scrotum, which is all the hair and skin, right? And then you have muscle too. And then you have this muscular coat here. It's called the cremasteric muscle. The cremasteric muscle is the covers a tube that contains several very important structures. Okay? It's called the spermatic cord. The spermatic cord is the connection between the inside of the pelvis and the scrotum, which is outside, right? So you have, there's several structures in there. All the important structures that have to get to the testes have to go in the spermatic cord. Okay, so what are they called? You know you have to have an artery, a vein, and nerves, right? And a tube for the sperm, right? So those are the four ones. And then you have lymphatics, and you have the muscle. So you have the spermatic cord. Okay, so what are some of the components? You have the vas deferens, or ductus deferens, same thing. You have a testicular artery, which is one of the large paired branches of the abdominal aorta, as you know. Okay. Then you have the piniform plexus. Okay? The piniform plexus, which is basically the testicular venous system. Okay? It's the testicular venous system. In other words, the testes and the penis has a very extensive venous network, right? A lot of veins, a lot of little veins. That's why prostate cancer is so dangerous, right? Because it can spread really easy because there's so many veins in there, right? Okay, so that's the piniform plexus, right? Testicular venous system, piniform plexus, that's what it's called. So you just say, if you want to remember, just remember the testicular vein, but there's like a ton of them, okay? Little veins. Okay, then you have the genitofemoral nerve, okay? That's the nerve supply to the area, right? Okay, so those are the four main structures. And then you also have this covering is called the cremaster muscle. That's the muscle that you see on here. Okay?
So all of those four
All
on
those
top
things are in the tube.
behind.
All these things are in this tube, okay? Okay, and then you also have lymphatics, of course. Okay, so you have all the stuff you need, right? You have the vas deferens or the ductus deferens, which is collecting or carrying the sperms from the testes where they're made out through the prostate and out the penis, right? Then you have the testicular artery, which is giving the blood supply, piriform plexus, which is the venous drainage, the genitofemoral nerve, which is the innervation, the cremasterium muscle, which is the cover, the protection, and you have the lymphatic vessels, which is draining the fluid. Okay? And all this stuff has to travel in this passageway here, because it all has to go from the pelvis to the testes, right? Because the testes is outside, literally. Okay, right? Okay, so that's, and then it's covered by the skin and muscle, which is the scrotum. Okay, so now, so the testis, if you look at from the inside, when you section it, this big area is the testis, right? And then you have this area here. Let me have your pen for a second. Okay, so you have this area here, which you're going to have to look at for yourself. It's a small little area, okay? All these testes have little septa in them and little lobules. And each one of those lobules is loaded with tubules, which I'll show you in a minute. You know where the seminiferous tubules are. Okay, I'll show you on the microscope. And you see the seminiferous tubules, okay? And these tubules, when you cut them open, you can see the sperm growing inside, and I'll show you on the microscope. And then they all dump out. They all end up in this network of tubules, okay? There's network of tubules that connects the seminiferous tubules with the epididymis, which is this, which is where you store the mature sperm. This area here, this network, is called the ret testis. Okay? The ret testis. Okay? And the ret testis is a little network of tubes. Okay?